Hi and welcome back to the S Health TV. This video was created from a full-length article on our health website. I'll drop the link to the article in the description box. After watching, please ensure you like, share and subscribe. And do not forget to come back for more.
Today, we're going to talk about a crisis that unfolds really every single day in Nigeria: maternal mortality. And look, this isn't just about some numbers on a chart. It's about real people, real families, and tragedies that are absolutely preventable. So we're going to dig into not just why this is happening, but maybe more importantly, what the path forward actually looks like. Just let that sink in for a moment. This one sentence, it says everything, doesn't it? It just perfectly captures the catastrophic failure that's right at the heart of this crisis. It's the final heartbreaking line in a story that should have had a completely different ending. All right, so let's unpack that. The story behind the quote. It's the story of a woman we'll call Mrs. M. And her experience, sadly, shows us the reality that far, far too many women in Nigeria are facing every day. So Mrs. M had already been through 2 C-sections, right? This was due to high blood pressure in her previous pregnancies. So for her 3rd child, you can imagine the thought of another major surgery was incredibly stressful. She was really desperate for things to go differently this time. And that one powerful desire, well, it ended up shaping every single decision she made from that point on. And because she was so focused on avoiding another C-section, she made a really critical choice. She decided to skip antenatal care altogether. Her plan, you see, was to just wait it out at home until her labor was really advanced before heading to the hospital. So when the time finally came, it felt like everything that could go wrong did. Her contractions got really intense, but her husband, who was rushing home from work, got completely stuck in traffic. And to make things even worse, there was no other car, no way to get her to a hospital. By the time her husband finally made it home, she was bleeding. They rushed to the nearest hospital, but they were turned away. Why? No power. And the backup generator? Broken. So they raced to a second hospital. The problem there? No doctor on duty. By the time they finally, desperately reached a 3rd hospital, it was too late. Mrs. M was gone. Now, Mrs. M's story is obviously a devastating personal tragedy. But the thing is, it's also a window into a massive national emergency. So let's kind of zoom out now and look at the staggering scale of this crisis. So you see this number 1,047. What does that actually mean? Well, that's the maternal mortality ratio. It means for every 100,000 babies born alive in Nigeria, 1,047 mothers die. That was the figure in 2020. And just to put that into perspective for you, that is the 3rd highest rate in the entire world. And you know, when you look at the global picture, it gets even more shocking. Get this, Nigeria, just one single country, accounts for more than a quarter. We're talking almost 29% of all maternal deaths that happen worldwide. That is just a staggering, hugely disproportionate share of this global tragedy. This right here just lays it all out, the huge gap between the goal and the reality. The 2030 Sustainable Development Goal, it's aiming for a target of 70 deaths per 100,000 births. 70. Nigeria's current reality is more than 14 times higher than that target. It's a massive gulf to cross. So the big question is, why? Why does this keep happening? Well, researchers have actually come up with a really powerful way to understand this kind of systemic failure. And what's incredible is how perfectly it maps onto what happened to Mrs. M. It's called the 3-delay model, and it's actually been around since 1994. It's super helpful because it helps us pinpoint exactly where things break down. It identifies 3 critical moments of failure. First, the delay in deciding to even seek care. Second, the delay in actually getting to a hospital. And third, the delay in receiving good care once you finally get there. Okay, so let's apply this directly to Mrs. M's story. That first delay, the delay in seeking care, that started with her personal decision to skip antenatal services. And remember, that was driven by her fear of another C-section and maybe not having enough information about her other options. Then we hit the second delay. This happened when she was finally ready to go to the hospital. Those external barriers we talked about, the terrible traffic, not having a car available, that meant she couldn't get to a facility quickly. That is a classic failure of infrastructure. And then the third and final delay. And this is the really devastating part. It happened inside the very system that's supposed to save lives.
power outages, broken equipment, no doctors on staff. It meant that even when she finally got to the door of a hospital, the care simply wasn't there. That's the delay in receiving quality care. Okay, so understanding the problem is obviously the first step. But now let's shift gears and talk about the solution. Because here's the good news, and it's really important. These deaths are preventable. And there's a clear 3-level strategy for how to do it. This model breaks prevention down into 3 key stages. You've got primary prevention, which is all about the stuff that happens before a woman even gets pregnant. Then there's secondary prevention, which is the care you get during pregnancy. And finally, tertiary prevention, which is the emergency care you need when complications pop up. It's a really smart, holistic way to look at it, covering all the bases.
So this first level, primary prevention, is really about building a super strong foundation. We're talking about things like enforcing girl-child education, women's financial empowerment so they can actually afford care, making sure family planning services are available, and just generally boosting health literacy so people can make informed choices way before pregnancy is even on the table.
Okay, next up is the secondary level. This is all about wrapping a woman in a strong system of care as soon as she becomes pregnant. It's making sure she gets all her antenatal checkups, guaranteeing a skilled attendant is there when she gives birth, and providing good care in those really critical weeks right after delivery. And last but definitely not least, you have that crucial safety net, tertiary prevention. This is all about making sure that when complications do happen, and sometimes they will, the system is ready to jump into action immediately. That means working ambulances, referral systems so hospitals can actually talk to each other, and having critical services like ICUs and blood transfusions ready to go at a moment's notice.
You know, when we look back at Mrs. M's story, we see a system that failed her on so many different levels. And that tells us something really important. The solution can't just come from one place. This has to be a collective effort, a shared responsibility.
Success here isn't about finding one magic bullet. It's about a truly multifaceted approach. It has to start with individuals being empowered with knowledge. It needs communities and their leaders to step up and challenge harmful traditions. It absolutely demands that we support and properly equip our healthcare workers. And holding it all together, the government has to create and actually enforce the policies that make all of this possible. And really, if you take away one thing from all this, let it be this. Yes, the numbers are grim. The stories are absolutely heartbreaking. But this is not an unsolvable problem, not by a long shot. The solutions are out there. They are known. They're based on evidence, and they are 100% within our reach. So that leaves us with one last really crucial question. If the solutions exist, if we have the blueprint to save these lives, then knowledge isn't the barrier. So what is? What's the single most important step we have to take first to turn this blueprint into a reality?
Please subscribe.